Joining me via Skype is President, National Association of Nigerian Nurses in North America, Dr. Emilia Iwu. Thank you for joining us on TVC Midday News.
Thank you for having me. Good afternoon.
Good afternoon. Now, talk to us how this initiative by the North America Nigerian Nurses Association would turn around primary health care in Ogun State and other states where this initiative has been taken.
Yes, for many years, up to 8 years, we've been doing, every year we do about 3 medical missions to Nigeria providing free services. However, we wanted to make sure that we are actually making impact in the local communities that have been, collaborating with us. So in 2018, we decided that we are going to invest in primary health centers because many of them are very close to the people that we serve. However, the buildings are not very well looking. So we decided that we are going to collaborate with the state and local government authorities to renovate and train the healthcare workers in those facilities to make sure that they are providing appropriate services at the grassroots. So when we started, we actually have been working with these communities, and everything we do, we usually engage the community because that's the way to make it sustainable. So all the renovations that we did, we work with the community leaders, and equipment that we provided. Also, we work with them and making sure that everything that we were doing with them, they take ownership for those things so that they can be very good custodians of those, equipment and services.
All right, Dr. Iwu, as much as it is important that they take ownership, what is the process for monitoring to ensure that efforts put in place do not go to waste and that they get the right quality health care like you have mentioned?
Yes. So because many of us are from these local communities, our program really started by asking our members to take us to their villages. And our medical missions were driven by those nurses from those communities. So when something is placed into your hands, it will be very difficult for you to misuse it. So what we do is every year, we go down, we come home, and we will visit these health centers. We are in communication with them from here in the first place, so they don't lose touch with us. So we make sure that we know what the needs are, the challenges they're having, and help them to, address those issues. And then we go home and we visit the centers. Surprisingly, we always go. We don't even tell them we are coming.
So
we make
talk
sure
to
that
us now, because of want of time, talk to us now about the level of collaboration in terms of training of the personnel that will be handling and manning this primary health care in the States.
Yeah, so this has been 2 years in the making. So this year, actually, we were planning to come home to Nigeria for our conference with our colleagues, the other nurses in Nigeria. This year was really supposed to be our year to train the healthcare workers and be on ground, make sure that we institute good monitoring and evaluation with documents, to show that there's evidence for the work they're doing. However, because of the COVID-19 pandemic, we haven't been able to physically come on ground, but we have maintained relationship with them. And if there's any challenges they're facing, we make sure we are in there and work with the local nurses to make sure that they're doing what they're supposed to do.
All right, Nigeria.
So our goal is to make sure there's quality.
All right, Nigeria will be 60 tomorrow, and one major concern for a lot of Nigerians is accessing quality health care. How would you want Nigeria to perhaps address this issue head on, since we will be 60 tomorrow?
Yes, many of us here that are providing what we call quality health care, we're actually trained by Nigerian institutions. Personally, I went to UNTH, and I did my midwifery in a year. No? So the quality of services, if we, the communities, the government, everybody work in maintaining these health facilities, the nurses really know what to do. The healthcare workers know what to do. But we need to improve the environment and the conditions where they work. So we want to make sure we invest in them and making sure that the environment they work is comfortable and they have the equipment that they need to provide the services needed by our people. So the quality can be there. We didn't just train here. Many of us trained at home. So in terms of knowledge and the skills necessary to do what's needed, it's really there, but we just need to harness those qualities.
All right, Dr. Emilia Iwo, thank you for your time on the Midday News.
You're very welcome. Thank you for having me.
You're welcome as well.